Hello, and a very warm welcome. If you're tuning in, chances are you or someone dear to you is contemplating surgery, and perhaps you've crossed that vibrant threshold of 70 years. It's a time in life filled with wisdom, experience, and yes, sometimes, new health challenges. And when surgery becomes a part of that picture, it's natural to feel a flutter of apprehension, a sense of uncertainty. You might be wondering, will I bounce back like I used to? Or what can I do to make this journey smoother, safer? Well, you've come to the right place. Because today, we're not just going to talk about surgery after 70. We're going to embark on a journey of empowerment. We're going to unlock 8 crucial secrets, 8 pillars of knowledge that can transform your surgical experience, helping you recover faster, sidestep those dreaded complications, and reclaim your vitality with confidence. Forget feeling like a passive passenger. It's time to become the active, informed captain of your health journey. So, take a deep breath, settle in, and let's explore these life-changing insights together. This isn't just about information. It's about igniting your strength and resilience. Your story of recovery starts now. First, let's delve into the very foundation of a successful surgical outcome, especially when you're blessed with the wisdom of years. It's all about 1. Comprehensive preoperative assessment and honesty, the unvarnished truth for a safer journey. Imagine building a magnificent house. Would you start without a detailed blueprint, without knowing the lay of the land, the quality of the soil? Of course not. Surgery, in many ways, is like constructing something new or repairing something precious within your body. And your doctors, they are the architects and builders. To do their job brilliantly, they need the most accurate, most complete blueprint of you. This is what a comprehensive preoperative assessment is all about. After 70, our bodies often carry a rich tapestry of experiences, a history that's unique to each of us. This might include conditions like a heart that's kept rhythm for decades, lungs that have breathed in a world of sense, or kidneys that have diligently filtered life's successes. Perhaps you manage diabetes, or arthritis whispers in your joints. These aren't just footnotes. They are vital chapters in your health story, and your surgical team needs to read every single one. Think of it like this. Your body is a finely tuned, vintage automobile. A classic. It has character, it has history, and it requires a mechanic who truly understands its intricacies before attempting any repairs. A superficial glance won't do. The mechanic needs to know about that quirky little noise it makes on cold mornings, or how it sometimes needs a bit of extra coaxing to start. Similarly, your doctors need to know everything about your health. So what does this mean for you practically? It means being an open book. This is not the time for modesty, or for thinking, oh, that little ache isn't important, or they don't need to know about that herbal tea I drink. Yes, they do. Every single detail matters. From that occasional skipped heartbeat you've noticed, to the fact that you sometimes get a bit breathless climbing stairs. From the vitamins you take religiously, to the glass of wine you enjoy with dinner. Let me share a little story. I once knew a gentleman, let's call him Arthur. Arthur was a stoic man, independent and proud. He was scheduled for a knee replacement, a common procedure. But Arthur didn't tell his doctors about the herbal supplement he was taking to boost his energy. He thought it was harmless. Unfortunately, this supplement had blood-thinning properties. During surgery, Arthur experienced more bleeding than expected. It complicated things, extended his hospital stay, and made his recovery tougher. Now, compare Arthur's story with another lady. Let's call her Eleanor. Eleanor, also in her 70s, was preparing for a similar surgery. She brought a detailed list of everything she took: prescriptions, over-the-counter pills, even a chamomile tea she drank for sleep. She talked openly about her occasional dizziness. Her doctors were able to adjust her medications, take extra precautions, and her surgery and recovery were remarkably smooth. Eleanor understood that honesty wasn't a sign of weakness, but a vital act of self-care. Your preoperative assessment will likely involve a series of tests. Blood tests to check your kidney function, liver function, blood count, and clotting ability. An electrocardiogram, or EKG, to check your heart's rhythm and health. Perhaps a chest X-ray to look at your lungs. Sometimes, more specialized tests are needed depending on your health history and the type of surgery. Don't see these tests as a hurdle. See them as your medical team gathering all the pieces of the puzzle to create the safest possible picture for your surgery. And it's not just about your physical health. Your cognitive health is important too. If you've noticed any changes in your memory or thinking, or if you've had episodes of confusion in the past, especially during a hospital stay, it's crucial to share this. This information helps the team take steps to prevent post-operative delirium, a temporary state of confusion that can be distressing. Remember, your surgical team is on your side. They are not there to judge you. They are there to help you. The more information they have, the better they can tailor the surgical plan, the anesthesia, and the post-operative care specifically for you. This honesty, this complete transparency, is your first and most powerful step towards a faster recovery and fewer complications. It's about building a partnership with your doctors, a partnership based on trust and open communication. You are an active participant in this journey, not just a patient. Your voice, your story, your truth, they are invaluable. So, embrace this first step with courage and openness. It truly sets the stage for everything that follows. Now, let's move on to another absolutely critical aspect, one that goes hand in hand with your overall health picture. This is about those little pills and potions that many of us rely on daily. I'm talking about 2. Medication management is crucial, navigating the pharmaceutical maze safely. Imagine a conductor leading a grand orchestra. Each musician, each instrument, plays a specific role, creating a harmonious symphony. Medications, in a way, are like those instruments. Each one has a purpose, a specific effect on your body. But when surgery enters the picture, the conductor, your medical team, needs to ensure that every instrument is playing in tune and that no rogue notes disrupt the performance. For many of us over 70, medications are a part of daily life. We might take pills for blood pressure, for cholesterol, for diabetes, for arthritis, or for a host of other conditions. This is what doctors call polypharmacy, the use of multiple medications. And while these medications are often essential for managing chronic conditions and maintaining our quality of life, they can become a complex puzzle to solve before surgery. Why is medication management so critical before surgery? Well, some medications can interfere with the surgery itself or with the anesthesia. For example, blood thinners like warfarin, aspirin, or even some common pain relievers like ibuprofen can increase the risk of bleeding during and after the procedure. These usually need to be stopped several days or even weeks before surgery. But stopping them without medical guidance can also be risky, especially if you take them for a serious condition like a heart stent or atrial fibrillation. Then there are diabetes medications. Some of them need to be adjusted because surgery and the recovery period can affect your blood sugar levels. Anesthesia can also interact with certain medications, potentially causing unwanted side effects. And it's not just prescription drugs we need to be mindful of. Over-the-counter medications, herbal supplements, vitamins, they all count. Many people believe that herbal remedies are completely safe because they are natural. But natural doesn't always mean harmless, especially when surgery is involved. For instance, supplements like ginseng, ginkgo biloba, and St. John's wort can affect blood clotting, blood pressure, or how your body metabolizes other drugs, including anesthetic agents. Let me paint you a picture. Think of Mrs. Davis, a sprightly 75-year-old preparing for a gallbladder operation. She diligently told her surgeon about her blood pressure pills and her thyroid medication. But she forgot to mention the fish oil capsules she took daily for her joints and the occasional St. John's wort she used for low mood. She just didn't think they were important enough. Luckily, during her pre-anesthesia consultation, the anesthesiologist, a very thorough doctor, asked her specifically about supplements. When Mrs. Davis mentioned them, the anesthesiologist explained that fish oil can thin the blood and St. John's wort can interfere with how certain anesthetic drugs work. They were able to adjust her plan, advise her to stop these supplements a couple of weeks before her surgery, and everything went smoothly. But it was a close call, a reminder that even seemingly innocuous substances can have a significant impact. So what's the action plan here? First, create a master list. And I mean a master list. Write down every single thing you take. The name of the medication, the dosage, how often you take it, and why you take it. Include everything. Prescription drugs, over-the-counter medications like pain relievers, antacids, allergy pills, vitamins, mineral supplements, herbal remedies, even creams or patches that contain medication. Don't rely on your memory. Check your medicine cabinet, your purse, your bedside table. Once you have this list, share it with everyone on your medical team. Your surgeon, your primary care physician, and especially your anesthesiologist. The anesthesiologist plays a critical role in managing your medications around the time of surgery. They will give you specific instructions on which medications to continue, which ones to stop, and when to stop them. They'll also tell you when it's safe to restart them after the surgery. It's absolutely vital to follow these instructions to the letter. Don't make any changes on your own. If you're unsure about anything, ask. Ask again. There's no such thing as a silly question when it comes to your health and safety. It's also a good idea to bring all your medications in their original bottles to your preoperative appointments. This helps avoid any confusion about names or dosages. And if you have any allergies or have had adverse reactions to medications in the past, make sure this is prominently noted in your medical records and that you communicate it clearly to your team. Navigating the world of medications before surgery can feel like walking through a maze. But with careful planning, open communication, and the guidance of your healthcare team, you can navigate it safely and confidently. Remember, managing your medications correctly is not just a small detail. It's a cornerstone of a successful surgery and a smooth recovery. It's about ensuring that the orchestra of your body plays a harmonious tune, even when undergoing a major event like surgery. All right, we've talked about understanding your body and managing your medications. Now, let's shift our focus to another powerful tool you have in your arsenal for a faster recovery: the fuel you give your body. Let's talk about 3. Optimize your nutrition and hydration, fueling your body for healing and strength. Imagine your body is preparing for a marathon, not a race of speed, but a marathon of healing. Surgery, no matter how minor, puts stress on your body. It's like an intense workout. And just like an athlete needs the right fuel to perform and recover, your body needs optimal nutrition and hydration to heal effectively after surgery. This is true for everyone, but it takes on even greater significance when you're over 70. As we age, our bodies might not absorb nutrients as efficiently as they once did. Our appetite might decrease, or we might have dental issues that make eating certain foods difficult. Sometimes, chronic conditions or medications can also affect our nutritional status. As a result, malnutrition or even subtle nutrient deficiencies are surprisingly common in older adults, and they can seriously hamper the healing process. Think of it like trying to repair a house with flimsy materials. The repairs won't be strong, and they won't last. So what are the building blocks your body needs for this healing marathon? Protein is a superstar here. Protein is essential for repairing tissues, fighting infection, and rebuilding strength. Think of lean meats, poultry, fish, eggs, dairy products, beans, lentils, and tofu. Aim to include a good source of protein in every meal, especially in the weeks leading up to your surgery. Vitamins and minerals also play crucial roles. Vitamin C, found in citrus fruits, berries, and bell peppers, is vital for wound healing and immune function. Vitamin D, which we get from sunlight and foods like fatty fish and fortified dairy, is important for bone health and immune response. Zinc, found in meat, shellfish, nuts, and seeds, also supports wound healing and immunity. A balanced diet, rich in colorful fruits and vegetables, whole grains, and lean protein, will generally provide these essential nutrients. But what if you're struggling with your appetite? Or what if you have dietary restrictions? This is where planning and sometimes professional help comes in. If you're concerned about your nutritional status, or if you've unintentionally lost weight recently, talk to your doctor. They might refer you to a registered dietitian, a nutrition expert who can assess your needs and create a personalized plan for you. A dietitian can suggest ways to boost your calorie and protein intake, recommend specific foods or supplements if needed, and help you overcome any challenges you might be facing with eating. Sometimes, simple strategies like eating smaller, more frequent meals, or adding protein powders to smoothies or soups can make a big difference. And let's not forget hydration. Water is the elixir of life, and it's incredibly important before and after surgery. Dehydration can increase the risk of complications like kidney problems, low blood pressure, dizziness, and even confusion. It can also slow down healing. Aim to drink plenty of fluids throughout the day. Water is best, but clear broths, herbal teas, and diluted fruit juices can also contribute. How much is enough? Your doctor can give you specific guidance, but a general rule of thumb is to drink enough so that your urine is pale yellow. Let me share a little anecdote that illustrates the power of nutrition. I remember a lovely lady named Margaret, who was 78 and scheduled for abdominal surgery. Margaret was frail, and her doctor was concerned about her nutritional status. He referred her to a dietitian, who worked with Margaret for a few weeks before her surgery. They focused on high-protein, nutrient-dense foods, and Margaret even started drinking a special nutritional supplement. The difference was remarkable. Margaret went into surgery stronger, and her recovery was much smoother than her doctors had initially anticipated. Her wounds healed beautifully, and she regained her energy surprisingly quickly. Margaret herself said she felt like she had given her body the super fuel it needed to heal. So, think of nutrition and hydration as your secret weapons in preparing for surgery. It's not about restrictive dieting. It's about nourishing your body, giving it the strength and resources it needs to navigate the surgical process and bounce back with resilience. This is something you can actively control, a way to invest in your own recovery. And speaking of investing in your recovery, why not share some of your own wisdom? What are your favorite healthy meals that are easy to prepare and packed with nutrients? Share your tips and recipes in the comments below. You might just inspire someone else on their journey to better health and a successful surgery. Your collective wisdom is a treasure trove, so let's share it. Now that we've fueled our bodies from the inside, let's talk about preparing our bodies from the outside through movement. It's time to explore the concept of 4. Prehabilitation. Get moving safely to build resilience before surgery. We've all heard of rehabilitation, the process of regaining strength and function after surgery or an injury. But what if I told you there's something you can do before surgery to significantly improve your outcome? It's called prehabilitation, or prehab for short. Think of it as training for your surgery, much like an athlete trains for a big competition. And believe me, surgery is a big event for your body. The idea behind prehab is simple. The stronger and healthier you are going into surgery, the better your body will cope with the stress of the procedure, and the faster and smoother your recovery will be. This is especially true for older adults, as building up reserves can make a profound difference. It's like putting money in the bank before a big expense. You'll have more to draw upon when you need it most. So, what does prehabilitation involve? It's not about becoming a super athlete overnight. It's about engaging in safe, appropriate physical activity in the weeks or even months leading up to your surgery. The goal is to improve your overall fitness, strength, endurance, flexibility, and balance. Let's consider the benefits. Regular physical activity before surgery can improve your heart and lung function. This helps your body tolerate anesthesia better and reduces the risk of post-operative lung complications like pneumonia. Increase muscle strength and endurance. This can make it easier to get out of bed, walk, and perform daily activities after surgery, speeding up your return to independence. Enhance circulation. Good blood flow is essential for delivering oxygen and nutrients to the surgical site, promoting healing and reducing the risk of blood clots. Boost your mood and reduce anxiety. Exercise is a natural stress reliever. Feeling physically stronger can also increase your confidence and reduce pre-surgery jitters. Improve balance. This can help prevent falls, which can be a serious concern, especially after surgery when you might be weaker or less steady on your feet. What kind of exercises are we talking about? It really depends on your individual health, your current fitness level, and the type of surgery you're having. It's crucial to discuss this with your doctor or a physical therapist before starting any new exercise program. They can recommend activities that are safe and beneficial for you. For many people, simple activities like walking can be incredibly effective. Aim for regular walks, gradually increasing the duration or intensity as you feel comfortable. Swimming or water aerobics are also excellent low-impact options that are gentle on the joints. Light strength training exercises, using small weights or resistance bands, can help build muscle. Stretching can improve flexibility and range of motion. And don't underestimate the power of breathing exercises. Deep breathing exercises can help improve lung capacity and prepare you for the breathing exercises you'll likely need to do after surgery to prevent lung complications. Let me tell you about Frank. Frank was 82 and needed a hip replacement. He was quite sedentary before and a bit fearful of the surgery. His surgeon recommended a prehab program with a physical therapist. Frank was skeptical at first, but he decided to give it a try. For 6 weeks before his surgery, he worked with the therapist, doing gentle exercises to strengthen his legs and improve his balance. He also started walking short distances every day. By the time his surgery date arrived, Frank felt stronger and more confident, and his recovery was remarkable. He was up and walking with a walker much sooner than expected, and he experienced less pain. Frank often said that prehab was the best decision he made. It didn't just prepare his body, it prepared his mind too. So, if you're facing surgery, ask your doctor about prehabilitation. See if a referral to a physical therapist is appropriate for you. Even small, consistent efforts can make a big difference. Think of it as an investment in yourself, an act of proactive self-care that can pay huge dividends in your recovery. It's about taking control, empowering yourself, and setting the stage for the best possible outcome. Remember, it's not just about adding years to your life, but life to your years, even when facing a surgical procedure. Prehab can help you do just that. We've covered the importance of a thorough assessment, medication management, nutrition, and prehabilitation. These are all about preparing your body and your internal environment. Now, let's turn to the mental and informational preparation. It's time to talk about 5. Understand the procedure, risks, and realistic recovery. Knowledge is power and peace of mind. Imagine embarking on a journey to a new, unfamiliar destination. Wouldn't you want a map? Wouldn't you want to know about the terrain, the potential challenges, and what to expect along the way? Surgery is a significant journey for your body and mind. And having a clear understanding of what lies ahead is like having a detailed map. It can reduce anxiety, empower you to make informed decisions, and help you navigate the recovery process with greater confidence and realism. When you're over 70, it's especially important to have these conversations with your surgeon. Your body may respond differently to surgery and anesthesia than a younger person's body. Your healing timeline might be different, and you might have specific concerns or priorities related to your quality of life. So, what does it mean to truly understand your procedure, risks, and recovery? It goes far beyond just signing a consent form. Informed consent is not just a legal formality. It's an active process of communication and understanding between you and your surgeon. It's your right to have all your questions answered in a way that you can comprehend. Don't be afraid to ask questions. Lots of questions. There's no such thing as a silly question when it comes to your health. Write down your questions before your appointments, so you don't forget anything in the moment. Here are some key areas to explore with your surgeon. The procedure itself. What exactly will be done during the surgery? Why is this surgery necessary for me? Are there alternative treatments? And what are their pros and cons? What type of anesthesia will be used? How long will the surgery take? The benefits. What are the expected benefits of this surgery? How will it improve my health or quality of life? What are the chances of success? The risks and complications. What are the common risks and potential complications associated with this surgery, especially for someone my age and with my health conditions? What are the more serious, though less common, risks? What measures will be taken to minimize these risks? The recovery process. What can I expect during the recovery period? How long will I be in the hospital? What kind of pain or discomfort should I anticipate? And how will it be managed? What will my limitations be after surgery, with activities, driving, lifting? What is the realistic timeline for returning to my normal activities? For someone my age, this might be different, and it's important to have that clarity. Post-surgery care: what kind of follow-up care will I need? Will I need physical therapy or other rehabilitation services? Will I need any special equipment at home? Sometimes, medical information can be overwhelming, filled with jargon and complex terms. Don't hesitate to ask your surgeon to explain things in simple language. If you don't understand something, say so. It's their responsibility to ensure you are fully informed. Consider bringing a trusted family member or friend with you to your appointments. A second pair of ears can be incredibly helpful for listening, taking notes, and asking clarifying questions. They can also provide emotional support and help you remember the information later. Let me tell you about a woman named Sarah, 72, who was facing a heart valve replacement. Sarah was understandably anxious, but she armed herself with knowledge. She researched her condition, prepared a list of questions for her surgeon, and took her daughter with her to every appointment. She asked about everything: the surgical technique, the type of valve, the recovery process, even the surgeon's experience with patients her age. By the time her surgery day arrived, Sarah felt informed and empowered. She knew what to expect, and she had realistic expectations about her recovery. This knowledge didn't take away all her nervousness, but it significantly reduced her fear of the unknown and helped her feel more in control of her journey. Her recovery was challenging at times, but because she knew what to expect, she was better prepared to handle the ups and downs. Contrast this with someone who goes into surgery with unrealistic expectations, perhaps gleaned from a younger acquaintance or a generic brochure. They might expect to bounce back in a few days, only to find that their recovery is slower, more arduous. This can lead to frustration, disappointment, and even depression, which can further hinder healing. Understanding the realities of your surgery and recovery is an act of kindness to yourself. It allows you to prepare mentally and emotionally. It helps you set achievable goals, and it empowers you to be an active partner in your care. Have you ever felt lost or overwhelmed by medical information? What helped you understand things better? Perhaps you have a tip for asking questions or for organizing medical information. Share your experiences and wisdom in the comments below. Let's learn from each other and support each other in becoming more informed patients. And hey, if you're finding this information valuable, if it's helping you feel more prepared and empowered, why not give this video a thumbs up? And if you haven't already, hit that subscribe button and the notification bell so you don't miss out on more content designed to help you navigate your health journey with confidence. Now that you're armed with knowledge about your procedure, it's time to think about what happens after you leave the hospital. This brings us to a crucial element of a successful recovery: your support system. Let's explore. These first 5 tips are powerful, but we're only halfway there. In Part 2, we'll uncover the remaining tips that can truly make or break your recovery journey after surgery. Don't miss it.